Hi, my name is Kim Mendoza, and today my group and I would like to talk to you about naloxone, a prescription medicine that's used to save lives of individuals with drug overdoses. I'd like to give you some background information before we start, just so you have some idea as to why this is a necessary drug. Just in case you're not aware, there's currently a drug epidemic going on in the United States. Just increases as the years have gone by. There's over 36,000 lives annually that are taken by drug overdoses. This rate since 1999 has risen by 102%. There is a federal program that's been instituted to help doctors track prescription drug use, opiates, oxycodone, those types of medicines, so individuals are not as likely to go doctor shopping. And that has helped to reduce the prescription drugs overdoses. However, heroin has quickly stepped in to take the place. Heroin is illegal, obviously, and it's available on the street at a much cheaper price than oxycodone is. Delaware is currently ranked number 10 for mortality rates in the United States and averages 15 deaths a month. So today we're going to be talking to you about naloxone, what it is and how it works, its purpose and possible side effects of using the drug, who are the targeted patients that would be using this medication, what actually happens to an individual during an overdose, how naloxone is used and its use has improved overdose rates, and then current legislation and funding that's being passed to try to make this drug more available. So first I'd like to start off and talk to you about what naloxone is and how it works. It's a non-controlled prescription medication, also referred to as Narcan. It's been used in emergency rooms since the 1970s, so it's not a new drug. What is new is the fact that they're trying to make it available to individuals out in the community. It's safe, it's effective. The most common distribution method use, how an individual would use it, is through an auto-injector like an EpiPen. There is also available a nasal spray that's in a stronger form, but that's not available in all the states at this particular time. What it does is it immediately reverses the effects of an opiate overdose. Mainly, it's the depressed respiration that an individual would be suffering from a heroin or oxycodone overdose, any type of that medication. However, although it would reverse the respiration problems, the sedation and stuff that an individual would be experiencing would still be present. It can put an individual into sudden acute withdrawal, which is a removal of the opiates from the system immediately, and they can become agitated and combative. So that could be an issue that you may have to deal with if you are administering the medication. The medication itself, when administered, only lasts 30 to 90 minutes. So the intent is to allow an individual time to seek medical attention because there's still other issues that need to be dealt with. So it's vital that you call 911 and get a person to regular medical care. So now we're going to talk about the purpose and possible side effects. The main purpose of naloxone is to reverse the effects of an opiate overdose. And it does this by blocking the opiate receptors in the brain. I'd like to refer to this picture right here. These are opiate receptors that are in the brain. And this would be the opiates, such as heroin or oxycodone. This is the Narcan, and you see how it will block those receptors. So the opiate is immediately removed from the opiate receptors. So some of the side effects, they're really kind of non-existent when you think about side effects of medication. If an individual stops breathing, their respiration is so depressed that they eventually stop breathing, and naloxone or Narcan is administered, they're either going to start breathing again, or worst case scenario, it won't work. So some common side effects that the individual would experience if it's administered would be the same as opiate withdrawal. An individual may have muscle cramps, nausea, diarrhea, runny nose, irritability, the same kind of things that an individual who had been regularly taking opiates, heroines, oxycodone, and stopped taking them. Same effects. Without this medication, however, an individual experiencing an overdose could have heart problems, lung problems, and brain damage due to lack of oxygen. So it is very important that they get this medication. If this medication is accidentally administered to someone who's not overdosing, there is no side effects whatsoever. It will not harm them. And another thing to note is, a lot of individuals will look for different medications to take. I'm going to take heroin, I'm going to take this, so people might take Suboxone. This will have no effect on them at all, that you can't get high from this drug. The targeted patients, the main individuals who would be administered this medication is someone who's overdosed from an opiate source. This could be a legal prescription, such as codeine, oxycodone, hydrocodone, or it could be illegal drugs, such as heroin. There are individuals who may be given Suboxone or methadone as part of an addiction treatment program, and they're told to look at their fingernails and other things for symptoms of overdose if they may accidentally have taken too much of their medications, such as blue fingernails, where they're not getting as much oxygen into their system. And they're told to contact 911 immediately and let them know that they are suffering from an opiate overdose. This drug can be given to somebody more than once. Some drugs you would build up a tolerance to, so if you were given it, it wouldn't work. This is not one that would fall into that category. So someone could be given a Narcan injection. 3 months later, they have another overdose, and they can be given another one. It would have the same effect, and there is no tolerance to the drug. This drug will not work on individuals who have taken too much antihistamines, alcohol, sedatives, stimulants, such as cocaine or amphetamines. It's only meant to work on opiate overdoses.
So what happens during an overdose? Well, opioid drugs such as heroin and painkillers taken in excess affect the central nervous system. This can cause symptoms such as sleepiness, loss of consciousness, and dilated pupils. It also has other whole body effects such as muscular seizures, and the full list of symptoms is described on the graphic on this slide. Breathing and heart rate slows, and eventually your heart and lungs can stop functioning. Without prompt medical attention, this can result in coma or death. This is where naloxone really comes in handy because it can delay these symptoms so that you have enough time to get medical attention. So how has naloxone improved overdose rates? Well, it started with New Mexico being the first state to pass legislation for the use of naloxone. Now over 17 states have approved its use. And more than 50,000 people are approved to administer naloxone to those who have an overdose. And as of 2010, naloxone has reversed the effects of over 10,000 overdoses. Legislation is being passed in numerous states to make this drug more accessible. Before, doctors feared prosecution for prescribing this drug to drug addicts, and now 25 states have passed legislation loosening these restrictions and making doctors feel more comfortable prescribing this drug. And the main goal here is to get medication to those who would be most likely to witness an overdose. This would be family and friends of known drug addicts, and this would really give us the highest chance of preventing these overdoses. The Good Samaritan law was also passed recently that would exempt those from prosecution for being in the presence of someone who's overdosing. It basically gives you immunity to seek medical help for someone who has an overdose. Funding is still the main issue for naloxone. Federal and state governments really notice this problem, and they really want to fund these community-based programs that allow people to get training on administering naloxone, but the money just isn't there. Once we get more funding, we can have greater distribution, more training, which is really going to lead to less opiate deaths overall. In conclusion, drug overdoses claim over 36,000 lives annually. Naloxone is a safe and effective drug that would reduce the rates of overdose death by delaying the symptoms of overdose and time to get medical help. Distributing medication to friends and family members of addicts is the best solution to preventing these deaths. And legislation is being passed across the U.S. to distribute naloxone to those who need it. Funding is still the biggest issue. We need it to develop these community-based programs that are going to give people access to naloxone and access to training on naloxone that are going to allow them to save lives. And here are all of our references. Thank you.